You hear me well? Yeah, it's 4 o'clock today, so and that's Saturday. First of all, my name is Lorenzo, Lorenzo Violante. I'm Spanish. I'm married. I have 2 kids. I think, sometimes we forget the most important thing, so let's start from the beginning. So, and I happen to work in the Red Cross. And I've been working in the Red Cross. I've been working in humanitarian work for over 15 years, a little bit more now. I'm more than 10 years with the Red Cross. And so, I could tell you about a number of experiences that I have had in the past. My work in Kosovo, in several wars, in South Sudan, in North Sudan, in Kenya, in Uganda, in Ghana, Niger, in Philippines, in Sri Lanka. But because I have kids, I have to settle a little bit in Panama and change a little bit of the type of work that I do. It doesn't mean that I don't miss those times in which I was at the forefront, of what we do. But now I'm in a little bit of a different situation now, and I'm there to support those who are at the front line, which are the volunteers, the staff, and the communities that are affected by disasters. So what is the objective that I want to do here? You're not going to see any text in my presentation. There are just a few pictures that I wanted to share with you. First of all, I really want to thank the University of Richard, the team, for inviting me to the event, because it's a privilege and an honor to be able to just share with you a couple of experiences of what ODK has brought to the life of the volunteers, the first responders, and the life of the people that we serve in the Red Cross. To pay that tribute to the family and to Gaetano for what he has done, and to basically, what the objective that I try to have in the next 10 minutes or so is well, Eric, I think that he already presented that well before, but to try and, from the angle of mainly humanitarian response, the impact of what ODK has brought to the lives of many thousands, I would say millions of people, in very short period of time. From the time we started this journey around 2011, without knowing Gaetano, as I was telling, I actually never met Gaetano in person. We spoke a couple of times over Skype, and that was I can tell you, a very strong learning experience for me. So this is what I tried to do. I just tried to present to you a couple of examples to try and show to you the impact of what ODK has done. And maybe before, as I already presented myself, I also want to present to you what the Red Cross is. And many of you probably are familiar with American Red Cross, the work they do in the blood banks, the work they do with the veterans, the work they do with disaster relief. I work for the International Federation of the Red Cross and Red Crescent Society. So we have 189 different American Red Crosses around the world, with different capacities, different expertise, and different areas of interest. So for us, it's a little bit of a complicated challenge to bring all these 189 different bodies together in trying to set common directions. One thing that I actually didn't mention before, there are 2 things that we are very proud of in the Red Cross. The first one, probably the most obvious one, is the network of volunteers that we have. And the one which makes us probably a little bit different than the rest of organizations. And the second one, which was also mentioned, I think Robin mentioned that before, talking about the fundamental principles, is that we are very proud of the 7 fundamental principles of the Red Cross. We're talking about humanity, impartiality, independence, neutrality, etc., etc. But being humanity, the most important one, by far. We have one, and then we have the others. We always said we don't necessarily have 7 principles. We have 1 principle plus another 6 principles, and humanity is the first one that we have. So we have this challenge of 189 different Red Cross and Red Crescent societies in the world doing very different things, and we need to try and find potential solutions for the problems that they face. And they face very many different problems. I mean, we have their pictures. That picture on the left is after tsunami in Japan. We have Nepal earthquake. We have Ukraine social crisis. We have Liberia Ebola. We have many different crises, and sometimes it's difficult to understand what are the needs of those national societies, what are the needs of the volunteers that are working on the ground there. I work now in the Americas region. We have our office sits in Panama. It serves 35 out of those 189 national societies, starting from Canada all the way down to Argentina. And believe me, we have very different capacities, skills, and needs in those Red Cross national societies. Yes, we have some very strong national societies like American Red Cross with a very clearly defined set of priorities. We have others. I mean, we have Bolivian Red Cross, we have Mexican Red Cross, we have Haitian Red Cross over there, and we have more. We have Colombian Red Cross, we have Nicaraguan Red Cross, we have many different national societies and with many different needs and many different priorities. And this is important for us because the range of what we do is very wide. I mean, from community health program to disaster response to migration issues to blood banks. It is a complicated environment, and we always try in the middle as a secretariat of the Federation to try and find solutions for all those, in this case, 35 national societies. So we have to pick and choose what are the most burning needs that affect the work that our volunteers do on the ground. And as you will see, ODK is one of those solutions that help us not just to meet the needs of this pure disaster response, that is helping us to meet many other needs of the programs that national societies or Red Cross is implemented in the America. So let's just talk about the experience that as a Red Cross we have had on ODK. The picture there on the upper part, right-hand side, it's on Haiti, 12 January 2010. Huge disaster occurred in Port-au-Prince and neighboring areas. It wasn't a big earthquake, to be honest. We had another one in the region 3 weeks afterwards in Chile, a much stronger earthquake, and we had a few people die. Of course, it was the biggest earthquake ever in Chile, but the magnitude and the dimension was enormous compared to the one in Haiti. But because of many different reasons, which we cannot discuss now, I mean, Haiti produced enormous damage with more than 200,000 people dying, and the entire infrastructure of a country or the state being collapsed. In that environment, many organizations came in. We had more than 1,000 new organizations being registered in the first few months after the earthquake. And we have one organization, which is the Red Cross, the Haitian Red Cross, together with all the national societies that went in and support the work of the Red Cross, that was able to provide in the first 3 months 75% of the entire relief operation, of the relief assistance in that country. The other 999 reported the other 25%. And it tells to you the importance of having a strong support, mutual support, and have a common understanding of how we need to respond to disasters. But anyhow, not to tell you these numbers, in that time of relief we have a huge challenge to be able to cope with the demand. We have more than 1 million people living in camps, and we're providing hygiene support, sanitation, water and sanitation, safe water, and what we call, non-food items to more than 400,000 people. At that time we had to use a solution to solve the problem of the distribution phase. It was taking 2 minutes to be able to distribute the relief assistance. It was too much, considering the volatile insecurity situation there. We were not using arms corps. We never used in in history. So it wasn't very easy. We finally found a solution, and we moved to the next phase. We found a solution. We had to do it very quickly in that time, and we got the support of a company in Mexico that helped us to find a solution. I mean, by which we could provide, we could move the distribution from 2 minutes to 2 seconds in a very short period of time. So we were able to distribute up to 15,000, 20,000 families in around 2 hours or so. It doesn't mean the logistics that imply that are very heavy as well. Now, we passed that phase, and then the next challenge came in. So we sorted out, in the relief cycle, we sorted out the issue of the distribution, the main challenge. Okay, that's solved. Now the problem is that we moved into the recovery phase, and we had around, at that time, I would say, the end of October, November 2010. By the way, we had cholera epidemic in October 2010 in Haiti. I will not discuss that now. We use ODK for that as well, but we have more than 1 million people living in camps. That's one of the major camps that we had in Haiti, in the center of Port-au-Prince, nearby our offices. More than 60,000 people living in there. The government was asking the Red Cross, we need to find a solution. We need to move the people out of the camps. They can't stay there. But it is literally impossible to build homes for 1 million people in Port-au-Prince, a city that is completely destroyed. We need to start thinking in a more creative way. Now, with the government, we discussed about what it was launched then as the Program 16C, which is possibility to start looking at alternatives way to sheltering solutions for families, which is basically the return and relocation program, rental subsidies to communities. We started with that program, and then we realized we couldn't cope. We committed with the government and we couldn't cope because the amount of data we need to produce, it was just, and to digest, it was enormous. We're talking about thousands and thousands of people, data, and we had the Associated Livelihoods Project. It was basically literally impossible. So we got back together and said, you know, what is it out there that can help us? We have no time to try to design a software or subcontract a software. And usually, I mean, literally by coincidence, we had these 2 very smart guys, engineers in our team, and they said, hey, listen, have you heard about ODK? So we started looking into that one. We never ever discussed even with university at that time. And in a very short period of time, we managed to relocate 15,000 families in less than a year's time. Then others followed. We have other institutions, in particular from the UN sector, following that, and it became a success. We have more than 100,000 families, of 500,000 people were relocated in a period of over 2 years. And most of them were using mobile devices to collect and process the data, to the point even to the distribution. Our distribution mechanism, basically, what you get out of the entire relief cycle, in this case the shelter cycle, was an SMS that would tell you, this is your PIN number. You go with one volunteer from Haitian Red Cross to the bank, you get the money, and you will go and pay somebody who's going to rent a house for you. This program, the fact that we were able to reallocate almost 100,000 people was completely impossible. We wouldn't have ODK. We would still be now trying to register and process data. And as I said, it was an experience that we started just by looking what is it available. But many others followed. It's not, and many others did it even better than the Red Cross did, and they reached even greater numbers. In 2 years, now you go to Port-au-Prince, there are almost no people living on the streets. I'm not saying the conditions are necessarily much better than what they were before the earthquake. What I'm saying is at least you have people that are not living under a tarpaulin. What is it that, we were trying to analyze, and I think it's been discussed, what is it that made this story a success? And why is it that success of ODK is open source? It's an amazing experience for us. getting to talk to the people from the University of Washington about their concept around open source is something new. I think that we discussed yesterday, this is very new to the humanitarian industry as well. We are not used to that, and there was an enormous competition not a long time ago. You know, for me, I mean, I'm the co-chair of the World Humanitarian Summit consultation process for the Americas, together with the government of Mexico, and we had this fantastic presentation by UNICEF. And it was very interesting because their approach, UNICEF approach, they're a leader on innovation, and they used to, in a way, compete, right? Present the best possible solutions, and they have a lot of resources. We don't have. We are a poor organization. We are the Red Cross. We don't have so much money. But the perception, the approach changed completely. They realized that they cannot work without having that open source mentality, meaning that whatever they develop, it has to be available to everybody. And this is a process. It's been a learning process also for us with other tools that we developed. The distribution tool that I was mentioning to you, now it's been used by many different organizations. You go to the redcross.org website and you can download the software and use it. I mean, it's very simple, but it has taken time for us. It's not just about the impact here, but also an impact, our mentality is about the open source concept. And the flexibility, the adaptability, the simplicity, the fact that we use it for the disaster relief, but we use it for community health program. There are many different reasons why we believe we need to study the ODK model as a model we want to replicate for other type of projects. I mean, as a Red Cross, we're looking forward to keep working with the university. We have pilots on ODK 2.0. We want to explore sensors. We want to look at early warning systems. There are many different things that you would like to explore with the university, because we believe that partnership with academic institutions and using that model and approaches like Gaetano with ODK is the way to go. Maybe just one more minute to tell you. This is a story of Haiti, but it is. I mean, but this is not the only one. I mean, we have many different stories, and I could spend hours and hours telling you about that. I mean, this is Jordan. We have Syrian refugees there. Hundreds of thousands of people have been now registered, and they receive cash transfer program using ODK. We have Costa Rica. This picture is from last week, actually, and the one up to the right, after floods, and people receive assistance using ODK. They're registered, and the distribution is done using mobile devices. The one at the bottom, Philippines, after Typhoon Haiyan. The funny thing is that in some cases, the ODK, somebody was asking me, we had this conversation before, it's like, how do you define success in the humanitarian innovation background? And how do we define it? Is because we define it when we cannot remember the way we used to do business before. So, guys, I'm sure nobody knows here how our lives were before mobile phones, right? For most of those national societies or Red Crosses, they don't now remember how the life was doing an emergency assessment without using a mobile device. In some cases, it's a standard operating procedure. I mean, Peruvian Red Cross, for instance, the one over there, they have banned paper in their emergency assessments. And they have done it together with the Ministry of Health, and they have done it together with the Ministry of Education. You cannot use it. Sometimes they are a little extreme, but they do it for a purpose. And again, I could keep telling you stories and stories about that. The only one that I want to conclude with is to say to the university, to say to the Gaetano's family, thank you. On behalf of the Red Cross volunteers, and on behalf of all the number of people that have received support, and they will keep receiving support, thank you, gracias, merci, super jazila.